Georgia is among several states being told to expect fewer doses of the Pfizer vaccine next week. Paulo Suro looks into why and how this could impact our community.
Georgia will be receiving nearly 40,000 fewer doses than anticipated next week, leading to concerns it could delay vaccinations for healthcare workers and long-term residents.
It is a significant amount. It really changes how people will handle different things. And we have to also remember the other cascading effect is, if you're trying to protect, for instance, frontline workers.
So far, Georgia has received about 84,000 doses this week. Next week, the state was planning on receiving another 99,000, but that number has since been reduced to 60,000. Governor Brian Kemp says this 40% reduction is due in part to supply chain issues that are being worked out.
I keep telling people I wish it was a lot more, but it could be zero.
But Pfizer says that's not the case. In a statement, the company says distribution is going well and that it currently has millions of doses sitting in a warehouse. The company adds that it has not received any shipment instructions for those. For its part, the Federal Department of Health and Human Services insists distribution isn't being reduced. They're just adjusting deliveries to spread them out across more days.
And this adds a lot of stress to the local public health infrastructure, which we know is underfunded in many places.
Bruce Wiley, who helped with the delivery of the swine flu vaccine back in 2009, says oftentimes manufacturers will provide an estimate on the allotment of vaccines, but that number is subject to change. He says this can be avoided with open communication between the manufacturer, distributor, and the government.
The problem is we have not seen an organized national response in general to the COVID-19 coronavirus pandemic. And the same thing is true with the vaccine distribution. The potential for confusion and the potential for further problems as a result is quite high in this situation.
In a statement, the Department of Health tells 11 Alive that it's disappointing to have allocations reduced, but is hopeful the Moderna vaccine will be approved soon too. The state hopes to receive 174,000 doses of Moderna's vaccine once the FDA approves emergency authorization. Coming up at 6, what Lee has to say about whether reduction in the Pfizer vaccine deliveries could happen again with the expected rollout of Moderna.